Hello, good evening, everyone. Thank you for joining us at our live Q&A event. We're going to take a few minutes here to connect as we're setting up the stream across multiple social media platforms. Okay, great. All right, so let's get started. Welcome, everyone. We're joined this evening with plastic surgeon, Dr. Kaitlyn Paine, and bariatric surgeon, Dr. Edward Cussatti. Let's start with some quick introductions. Let's start with you, Dr. Paine.
All right. Well, hello, everyone. Thank you for coming and joining us tonight for this conversation. I am one of the plastic surgeons that's part of the New York Bariatric group. I did my medical training at University of Pennsylvania. And then after that, I did my plastic and reconstructive surgery training at Mount Sinai Hospital in New York City, just south of where I am now, because I mostly work in Westchester and Connecticut. So after 6 years at Mount Sinai, I then got a job here at NYBG and have been working here ever since. Loving it.
Great. Dr. Cussatti, let's learn a little bit about you.
Hello, everyone, and welcome to our question and answer session this evening. My name is Dr. Edward Cussatti. I'm a general and bariatric surgeon stationed here in Long Island, New York, West Islip. I've been a bariatric and general surgeon for 20 years. My training in general surgery took place at the Stanford Hospital in Connecticut, and my specialty training in bariatrics at the University of Pennsylvania. I've been doing, as I said, bariatric surgery for about 20 years, focusing on all types of different bariatric surgical interventions and revisional surgery.
Great. Dr. Cussatti, what are some common questions you get about plastic surgery that you would like to start asking Dr. Paine?
The most common question that I get from patients is, what is body contouring surgery after bariatric surgery?
Yeah, so I think that's a fantastic question because a lot of people think that body contouring surgery is weight loss surgery, but body contouring is actually what happens after you lose the weight. So when you are at a stable, healthier weight, kind of met your goals, oftentimes people notice that they may have some extra skin in certain areas that they didn't have extra skin in before, or that they have certain areas that maybe have some stubborn fat that's creating a lump or a bump that they don't particularly like. And that's where body contouring kind of comes in, where we kind of help remove the areas that have a little too much extra skin and smooth out the areas that may have little lumps or bumps that are kind of sticking around. So while it doesn't necessarily offer all the health benefits, you already did that part, you lost the weight through the bariatric part or the medical weight loss or through your own diet and exercise, it helps smooth out the stubborn areas or some of the extra skin that you may notice afterwards, just so you fit in your clothes better or to help decrease sort of irritation or problems that you may have that you notice with dealing with extra skin.
Thank you. Yeah, that is a very common question that we get, and a very common misconception about that people have about body contouring, thinking that it is a kind of weight loss procedure.
Mm-hmm. It offers different benefits.
Yeah,
but not gonna do it. But then I was gonna actually ask you, because I do have patients that come into my office, and sometimes what they do need is bariatric surgery, not necessarily, or not even bariatric, but additional weight loss. And a lot of them sometimes have concerns, how safe is bariatric surgery? They get very nervous about the idea of undergoing surgery.
Yeah, it is a very common misconception today. And it has some historical basis to it, I guess, this misconception. In the past, in the infancy of bariatric surgery, some 25, 30 years ago, bariatric surgery did have higher risks, higher complication rates, because it, like any specialty at the beginning, your practitioners are learning the safest way to perform these procedures, but in the interim, of course, the risks go up. And so to many, bariatric surgery is still seen as a very risky endeavor, a very high risk procedure, that's fraught with potential risks and problems. And the reality is very different. In fact, today, bariatric surgery is some of the safest general surgeries we do. And I still do most of general surgery. I do colon surgery, I do intestinal surgery for other reasons, be they cancer or benign disease or even, cholecystectomies, gallbladder removals, and complex hernia repairs. All these operations have higher risks in reality than bariatric surgery. Bariatric surgery is, again, some of the safest general surgical interventions we do, and in no small part thanks to the way that we evaluate patients today, the preoperative evaluations and consultations. It's very extensive, it's very thorough, and so the surgeries are very, very safe. The risks are very low. Let me go on to my next question for you, which would be, are any of your procedures covered by insurance? It's often a concern of patients after they've lost weight or even before they lose weight, honestly, am I going to have a lot of loose skin? And if so, what's my recourse once I have this? So the insurance question is a big one.
Yeah. So I would say that very often these procedures are at least partially covered by insurance. In terms of insurance coverage, insurance tends to cover things like skin removal. It can cover skin removal in a variety of areas. Those areas commonly include the abdominal area, sometimes sort of the back end or buttocks area, arm and chest area in both men and women, and then the thigh area. Once in a while, you can get some other things covered depending on people's presentations and complaints, but those are generally the most popular ones. In terms of getting things covered by insurance, important things are sort of documenting the issues that you're having surrounding the extra skin. So oftentimes when people have extra skin, they develop irritation or rashes, or the extra skin can be very irritating or aggravating to the neck and shoulder areas, or the lower back. And so when people come in and have those kinds of complaints, it's often very helpful if they have a history of, trying to treat the rashes or trying to treat their neck, shoulder, lower back pain, and kind of, just documenting what's been done or tried, how long you've tried it. And then, maybe taking a picture of the irritation or the rash and things like that. And those are all things I try to work with my patients to get that additional information, so they're more likely and just have a better package for when we submit to insurance.
Sure.
Yeah. In terms of bariatric surgery, I know there's a lot of options in terms of different procedures. There's like the gastric sleeve, there's a Roux-en-Y. How do you kind of approach discussing those options with patients? Like, how does a patient choose which procedure might be best for them?
Yeah, it's a great question because there's no one test that we can submit to patients that would let us know, okay, this patient is an ideal candidate for this operation, or that patient's an ideal candidate for that operation. And so the way we make that decision is very much something we do with patients. There is an extensive preoperative evaluation period that has to take place where we evaluate patients' health overall, their heart function, their lung function. They go through a psychological evaluation just to help them with any kind of trouble with their relationship to food, let's say, over time, in preparation for surgery. And so depending in part on what medical problems they may have, that's one of the, let's say, one of the criteria we use to determine what procedure they may do best with. But let's say a patient has no particular medical problem that would lead us away from certain surgeries and have to focus on another. As long as a patient's options are wide open, what we do is we discuss all the options with patients. There are several different types of bariatric surgeries, and of course they have a different risk to benefit profile. And so we would review those different options with them. review the risks, review, of course, the benefits, review the alternatives to those procedures, and then make that decision together with the patient. It's much less a situation where we're dictating which surgery they're going to have, and more of a collaborative effort in coming to an understanding of what the best options for them would be. Certainly, if a patient is not a good candidate for one of the operations, then we wouldn't offer them that, and we would have them focus on the others. But then the decision would be made jointly amongst the options that they do have. And so that's a great question, because it is something that patients are always kind of wondering about. How does that decision get made? Mm-hmm. Let me ask you a question in terms of once patients have had their weight loss surgery, what are some of the criteria that you look for to say, okay, you're ready for surgery, or maybe you want to wait, or maybe this is the best option, or another?
Yeah. I think it's kind of funny because a lot of times it's not my criteria, it's the insurance company's criteria.
Sure. Yeah. That's a reality of all things, unfortunately. Yeah.
So for most insurances, they like to see patients be at least 1 year, if not 18 months after their bariatric surgery. The idea behind it is they like to see the patient's weight be stable from generally somewhere between 4 to 6 months. So a great time to kind of see, I'm happy to talk to anybody anywhere kind of in their weight loss journey, just because I think it is really informative, and I can always help them work on things that, if they have concerns, how to kind of help position themselves to be a better candidate for having things covered by insurance. But ideally, you would be close to or at your goal weight, be sitting at a very stable weight for 4 to 6 months. I do look at patients' sort of body mass indexes, which is just sort of a measurement of your height to your weight. In the plastic surgery literature, there's a slightly increased risk of sort of small problems, things like maybe a little part of the incision opening up or getting an infection. And that risk goes up if people have BMIs over 30. I don't use the BMI of 30 as a hard cutoff, though. I operate lots of times on people with BMIs of 31, 32, 33, sometimes even as high as 34, 35, depending on how much weight they lost, because it's very hard to, sometimes meet that below 30 goal. But I think that patients ideally should be hopefully aiming for that low 30s, if not, the best weight loss that they can achieve. The other criteria is, a big thing for plastic surgery, because there are incisions that need to heal, is to not smoke. So if you are a smoker, just to be aware that for the time that you're undergoing the procedure, generally 4 to 6 weeks before the procedure, and then 6 weeks after the procedure, you would need to be okay with not smoking. And that includes anything like e-vapes, marijuana, cigarettes. If you do a marijuana, switch to like an edible, something of that nature, just because, once again, increases your risk of wound healing complications. And then in terms of other criteria, most things are all workable within plastic surgery. It's just risk reduction. So if you come into the office and I see certain things that might put you at slightly risk, then we talk about ways to make the surgery safer for you and how we can kind of reduce the risk of you having complications. Yeah. Another thing, another concern. So sometimes, I definitely have patients that come into clinic who had surgery, possibly had a sleeve or another surgery, but haven't quite met their weight goal yet, or unfortunately have regained some of the weight between their surgery. Are they patients able to get another surgery if they regain weight after something like a gastric sleeve?
Yeah. In fact, a lot of what we do today is revisional surgery in one way or another. In other words, we'll see patients, it's not infrequent that we see patients that have had weight loss surgery in the past and had some measure of success with weight loss, and maybe then experience some rebound and weight regain. It generally tends to happen some years after their initial operation. Sometimes it has more to do with the original surgery they had. Maybe it was a surgery that was done at the very beginning of our experience as a specialty with bariatric surgery, and the procedure they had has been maybe modified significantly over time or has been abandoned. And so that's a patient that would probably be a better candidate for an operation to revise the operation that they have. But what I find is that many times we can help patients that have regained weight without the need for surgery, even though surgery, a revisional surgery, is always an option. In my experience, the reasons people start gaining weight is very clear once you just sit down and talk to a patient a little bit. Sometimes they just haven't been taught some simple lifestyle changes that really are critical for success long term. And you know, it's amazing how when you just sit with people and you talk to them, really even for a short period of time, you quickly realize what they're doing wrong. And if you can clarify it to them, it's really like a bit of a revelation where they thought they were actually doing something in terms of their habits or their food choices that were good for them, but in reality are the exact opposite of what they should be doing. And so absolutely, patients are often candidates for changing surgeries into other surgeries. But I find more often than not, we can help them without the need for surgery, and just some changes to their lifestyle that'll yield tremendous results with the surgery they have currently.
Excellent.
I know that there are lots of different procedures, and you mentioned some of them in terms of lifts and tummy tucks and back procedures versus front. Are these operations that have to be staged and done separately, or how would you plan these different surgeries if a patient needed multiple interventions?
Yeah, so I know for a lot of patients, sometimes people come in with this idea that we can do everything at once, or it's like a total transformation.
Complete change, right?
Complete change, yes.
Yeah.
I know some TV shows have sort of popularized that idea. There are some things that I can combine together, and I am pretty flexible when I talk to patients about seeing if there's things that we can kind of maybe add on, or kind of stage in a way that maybe you're getting a little bit more done at the same time. In terms of how I approach the body when I'm thinking of doing a patient who has concerns with multiple areas, let's say a patient comes in with concerns about the front and the back, the chest, the arms, and the thighs. Oftentimes I can work on the abdomen and the lower back at the same time, doing something called a lower body lift. During that time, I'll do, oftentimes a full tummy tuck where I'm, removing the skin, tightening the muscles, doing some liposuction. And then on the back, maybe doing some additional liposuction, removing any additional skin from the back that the patient may have if they're noticing a lot of drooping of the buttocks or a lot of drooping around the outer thighs. And then I can also take that fat that I've liposuctioned and sometimes also place it in the buttocks at the same time, to really transform that whole, circumferential trunk. And that tends to be a pretty powerful move to do all at once. And it's also where I like to start because it kind of sets the tension for everything else. After that, I can work on the chest and the arms off for both men and women, often in the same surgery. And then the thighs, generally I do third as a separate. Sometimes I switch it up between the thighs and the chest area, depending on what the patient wants. And then if patients have complaints about the face area, oftentimes that I do that last. And I can't do all of those things together at once. I can do them as soon as 3 months apart. So as long as you healed well from your previous surgery in one body area, I can move on to the next body area after 3 months.
Interesting.
Yeah. And then I guess my question for you, which I feel like for your procedures, the patients are like, I turned around so quick. And then for my procedures, I'm like,
now we send them to you, and
yeah.
not so much.
Yeah, I'm like, it's a little longer of a recovery. Not that you're in discomfort the whole time, but just because you have to be a little more careful because my incisions are so much longer.
Sure. Yeah.
But in terms of after bariatric surgery, how much time do patients commonly need to take off from work or activities after a bariatric procedure?
Yeah. And that's a great question because, probably around 70-75% of our patients are young women that are obviously in the workforce or have families, have young kids, and they want to know, what they can and can't do and how quick they can get back to their lives. And so it's a really important question. And of course, some of that, the answer to it depends in part what it is you need to go back to. If you're going back to a pretty strenuous job where maybe you're having to move heavy objects or if you're doing physical work, then the answer is we don't want patients lifting anything over, let's say, 20 to 30 pounds for the first month after surgery. We just want them doing normal daily activities, of course, walking around. Patients walk the very day of surgery. So walking is of course fine, and going up and down stairs and that sort of thing, and helping young kids with things is going to be fine. After that first week, where we tell them, look, the first week is really a time where you should just be kind of taking it easy, just walking around, but nothing strenuous, get a little bit of help at home. And so that first week tends to be the time where we want them just to kind of relax. After that, if their job isn't, a strenuous job where they're maybe working at a desk or not, and again, not doing physical stuff, then a week to 10 days is, I think, perfect to go back. Patients do feel a little fatigued, but these operations are not really painful surgeries for the most part. As you mentioned, the incisions, these operations are done laparoscopically with small incisions the width of a nickel. And so the pain is really not a tremendous factor in the recovery. It's really just kind of letting them get their energy back, which the first couple of weeks is a little bit tough. And so, for something strenuous, I'd say a month, is legitimate and a realistic thing. You did mention some about the recovery period for your patients, and it makes, of course, perfect sense that some of that would depend on how much you're doing all at once. But what is a recovery like? I know that I'm often asked, will I have bandages to take care of, or will there be home care for me? So what is the recovery like and the postoperative period like for some of your patients, given a certain procedure?
It's so funny, even though I work on lots of different body parts, my recommendations are almost always exactly the same.
Yeah.
So generally, for my patients postoperatively, most of my patients go home the same day. The only exception of that is if I'm doing a full lower body lift, then I do encourage people to at least spend one night in the hospital. Most of my patients, when they leave, they will have some kind of compression garment on. Generally, that's a special kind of girdle or faja that I'll assist them with buying, and you'll wake up with that the day of surgery. And then when you go home, most of my patients, I do send home on several different, I give all my patients numbing medication while they're asleep during surgery. And then I do tend to send them home on several different pain medications, just to make sure they're as comfortable as possible. Generally the first 2 to 3 days are kind of the most uncomfortable. And most of my patients, I do send patients home with a little bit of a narcotic medication called oxycodone, depending on what they want, depending on what they tolerate. Most of them stop taking that within the first 2 to 3 days, if they take it at all. And then after that, tend to do very well on some Tylenol, a little bit of gabapentin, and sometimes a muscle relaxant. And most of my patients are off of any kind of pain control medications within generally the first, if not second week. In terms of going back to work, if you work a desk job, I generally say somewhere around 2 to 3 weeks to get back to a desk job, depending on what you've had done, just because it can take a week or two to, I do use drains, which are thin, flexible plastic tubes. They don't hurt to take out. They are a little annoying while they're in. But those are generally in for a week or two after surgery. And most patients like to have them out before they go back to work. You don't have to by any means, but just for presentation, no one really likes walking around with them.
Sure.
And then in terms of getting back to light cardio, I generally say somewhere around 3 weeks, and then getting back to your full workout routine, being able to lift more than 5 to 10 pounds, I generally say 6 weeks. Most of my patients are feeling a lot better, generally around the 3-week mark. They're feeling pretty ready to go back to things. The reason why I have to say 6 weeks to lift anything heavy is just because it takes that long for a scar to become strong. So even though you might feel ready for it, your scar just might not be quite ready for it at that point.
Sure.
So you just have to be careful with it. But,
Yeah, that's a common occurrence after laparoscopy where they see small incisions, and granted, we don't have, generally speaking, the big incisions, but it's still inside. A lot was done, and so that's areas that need to heal, and that's where all the fatigue comes from. All their energy is kind of going towards healing, so the time is still necessary.
And then my question for you, because I know obviously when you have bariatric surgery, you're kind of working with you have kind of a goal in mind, and there's a lot of support that needs to happen afterwards. So how often do patients follow up after a bariatric procedure?
Yeah, follow-up is critical. It's one of kind of the the rules that we start teaching patients even before surgery, that follow-up remaining part of a program or a plan that can help them going forward is really critical. So obviously initially the follow-up is going to be a little more frequent because there's the immediate post-operative period where we want to make sure that patients are doing okay. And so we'll routinely see patients about a week to 10 days after surgery in the office. Patients will have surgery, they stay overnight for the most part, and then go home the next day. And then we see them about a week to 10 days in the office. As long as they're doing okay, then we'll see a patient again at the 1 month mark, and probably again for another month or two thereafter, monthly. After that, we'll see them every 3 months for the remainder of the first year, just to make sure that they're, again, keeping to that lifestyle change, following some real good, healthy eating habits and lifestyle changes that are going to be critical. And as long as they're doing well towards the end of the year and they're hitting their kind of goals, for the second year, we'll spread it out to every 6 months, so a couple of times, and then thereafter once a year. It's important that patients remain consistent with that follow-up. Even though it's just once a year, it's an important part of the plan to keep them kind of engaged in the lifestyle changes and keeping the weight off, which is obviously just as important as losing it, but doing it in a healthy way. We certainly don't want patients to fall into bad habits where sometimes they kind of overdo it with their weight loss and feel kind of really compelled to diminish their eating as much as possible. We want patients to do this in a very healthy way, and we can really help them do that if they maintain that regular follow-up.
I love it.
Great. Great. We actually have a couple of questions that are coming through our social platforms. So one of the questions we have is regarding anti-aging. Dr. Paine, what kind of options are available for that?
That's a really broad topic and could be that could be its own lecture. Most important things with anti-aging is sunscreen. Please wear sunscreen every day and reapply during the day. And then in terms of other options, I would say then, that would be a really good indication to kind of come and talk to someone who's, board eligible, either a plastic surgeon or dermatologist, to kind of talk about different options and your specific concerns that you have regarding aging, because it's very broad. But sunscreen. Prevention is key.
Yeah, we actually had a question coming in regarding pregnancy. So for Dr. Cussatti, at what point, should a patient consider a pregnancy following bariatric surgery?
Yeah, that's a very common question. Like we talked about earlier, a large percentage of our patients are young women, 20s to 40s and 50s is a major percentage. And so these are women that are still building families. And so a very common question is, will this have any impact? Will weight loss surgery have any impact on my ability to have a baby? And my answer to them is that the only impact it will have is that it'll make pregnancies a lot more likely. Obese women do suffer, unfortunately, very frequently from infertility due to their obesity. And so weight loss surgery increases their fertility tremendously, makes pregnancies a lot more successful. The next thing that I tell them is that there are lots of studies that have proven that pregnancies after bariatric surgery are much more successful and much healthier for the mother and the baby than pregnancies are before bariatric surgery. So, not only are there no ill effects, as long as patients, of course, are getting regular follow-up and eating and losing their weight in a healthy way, no ill effects to pregnancies. In fact, they make them much more successful in the long term. In terms of the timing, we certainly don't want patients to submit planned pregnancies to an environment where they're actively losing weight. So we generally recommend, at least a year, 18 months is a good kind of time frame to say, okay, you can start planning to become pregnant at that point. And so that's more or less the time frame we give them.
Okay, great. And a question about for Dr. Paine, what is a mommy makeover and how is that different than body contouring?
Essentially, they are two different parts of the same spectrum. A mommy makeover is generally something that is done oftentimes on a woman who has been a healthy weight for most of their lives, had a child, and then has now had children are wonderful, but they're also nature's tissue expander. So the muscles in front and the abdominal skin often get stretched out, as well as sometimes the breast tissue. So a mommy makeover can be a lot of different things, but generally it's something that addresses both those issues, addresses retightening the rectus muscles, removal of any excess skin, and then improving kind of trying to bring the breasts to return back to their pre-pregnancy shape, whether through a breast lift with augmentation, or a variety of other procedures. But generally, if you lose weight, though, the issue is you don't just lose that weight in the front, you lose it circumferentially. And so more often with patients that I have who have lost weight, whether through bariatric surgery or just on their own, or even after pregnancy, maybe they got a little heavier than they wanted to during their pregnancy and lost it. And then now have loose skin in more areas than just the front. In that case, then we start looking at more circumferential types of procedures to do it. But I do body contouring on, people who have lost weight. I've done body contouring on people who haven't lost weight. It's just a series of procedures to help people deal with either extra skin or a little bit of stubborn excess fat.
All right. Dr. Cussatti, there's a couple of questions in the chat box for you.
Okay. Okay, I was told that I'm a candidate for same-day surgery at a surgery center. Do a lot of patients do this? Is this normal? Yeah, it's becoming much more normal. Same-day surgery for bariatric surgery is becoming the norm, and it's started more in Texas, where they do a very, very large volume. We do a significant volume here in New York, but in southern US, they started doing outpatient procedures like sleeve gastrectomies in selected patients. And so if you've been told that you are a candidate for an ambulatory surgery, then it's been proven to be very safe in selected patients. There is a period of observation, of course. It's a little bit misleading to think that you're going to have the surgery and then and then go home right away. There's definitely still a period of observation and period of recovery where you're in the hospital for a few hours or in the surgery center for a few hours. And then you'd be going home. So it's not an immediate discharge, but certainly these procedures can and have been done safely for years in a different setting. And so it is very much becoming the norm for selected patients.
All right, and one additional question here in the chat box. If I work out in the gym, will I still have extra skin?
You can certainly help that. I have had patients that have lost a lot of weight and were, really into exercising and working out, and that definitely helps. To be able to tone muscles and build muscle mass. It'll help. Will it eliminate it all entirely? No, quite possibly not. And certainly it does depend on how much weight you have to lose to begin with, right? If you're carrying a lot of weight and you've carried it for a long period of time, then it stands to reason that, in spite of all your efforts at exercising, you're going to have loose skin. But I've certainly had many patients that are young and don't have some bad habits like smoking or haven't had a lot of damage to their skin with the sun, just like Dr. Paine said, and they like to exercise a lot, and you could barely see any loose skin in them. But it does depend on patients. Different patients respond differently after weight loss surgery. So exercise helps without question, but it may not take care of it all entirely.
Yeah, just to add to that, I would say exercise and, being a healthy weight and kind of, all the things that you do right before you undergo a body contouring procedure will only make that body contouring procedure more powerful, and you'll have a better result from it and you'll be happier with it. I have a lot of patients that do come to me and they have a lot of loose skin and they do feel like friends or family members, and I always feel really bad for this, tell them that they can exercise it away. And, when I evaluate them, I see that they are actually a very thin person. And really all that is there is just skin. I mean, sometimes I don't even liposuction some patients because I'm like, you are just skin. And, it really is a skin removal procedure for those patients. And for it, while exercise I think is helpful, obviously, and if you gain enough muscle, could you possibly refill the kind of not the hole, but the looseness with muscle to some degree? Yes, but especially when patients are losing a lot of weight, that's pretty hard to refill with just muscle. Oftentimes you do really need to remove some skin. Even sometimes when patients come in for when you think of fat transfer to the buttocks or things like that, a lot of times patients do need a little bit of skin removal to really get the benefit of that result, even if I am putting fat into that area. And that's sort of the importance of kind of talking to a plastic surgeon if you have those concerns, because a lot of my job is kind of differentiating between what is loose skin and what is amenable to what needs to actually be excised and what is extra kind of fat cells and maybe could be amendable to something a little less invasive, like just liposuction. Although I have to say most people come with a little bit of both.
Yeah, I always tell patients that many patients come in with that fear of, losing weight and not wanting to have that loose skin. Will I have loose skin, and what I tell them is that, all the things we just discussed, of course, but in the end, if you do have some loose skin, you have options. You have many different options in terms of body contouring and other things. And that's a great problem to have ultimately, if that is your problem. That it simply means that you've lost weight, that you're probably a lot healthier for it. And overall, you'll be in a much better place if that's the problem that you have to contend with. So So, I always tell them that. I try to show them the reality that it's actually a real good problem to have in the end,
I think when patients see me, I'm like, you have done everything right when you're seeing me.
Right.
But yeah, some people do retract. Some people have great genetics, like
Yeah.
some people have the genes and their skin retracts. And I have seen people who've done a beautiful job retracting on their own and been really impressed despite losing a lot of weight. But it's definitely not something I think anyone should feel like bad about, like that they couldn't exercise away their extra skin, because that's sometimes just your genetics,
Sure.
it's like the way you are. And that's why people come see plastic surgeons. It's not like just a vanity,
Right.
thing. It leads to real issues and problems,
Yeah.
And then also, some things you just can't also fix without surgery. Like, when the muscles of the rectus get spread out, you really just have to put them back together. And you can't, like, you can exercise, you can make those muscles stronger, definitely. And you can do a lot of good work, and the stronger and more you exercise, the better results you're going to get. But your body won't naturally put them back together without someone
Right.
suture back together. Yeah.
All right, Dr. Cussatti, there's a question about nutrition. What should that look like leading up to surgery?
Well, the main things that we teach patients is that they want to start practicing a lifestyle change prior to surgery. And I've kind of boiled it down to 5 rules or lifestyle changes that they want to start following. And so really that's what I teach them. I don't put them on kind of, prepared meals or anything like that. Certainly we do have them go on a liquid diet for a couple of weeks prior to surgery, but that's really more just to kind of help them shrink down the size of the liver, which will make the surgery much easier for them and for us. So that's kind of a little bit of a crash scenario just before surgery. But other than that, we have them start the lifestyle changes, which really revolve around those 5 rules that I was telling you about. One being normalizing their meals, right? And so rule number 1 is to have 3 meals a day. The notion that patients are going to have multiple meals a day throughout the day may work in certain scenarios for patients that maybe are going to be more active than some of our patients who can't be as active as they'd like to be. But it doesn't tend to work in bariatric patients very much because it lends itself, having multiple meals a day, lends itself to kind of using food for the wrong purpose. We do battle a lot the use of food as a comfort and as an emotional, tool, let's say, to get over emotions, right? That we all have to battle throughout our lives, right? Anxiety, stresses, anger, emotional things, boredom even, right? So if patients, which is pretty common, are using food to satisfy those issues, they're going to find it very hard to lose weight. They'll sabotage their weight loss after surgery. So first thing is to normalize their meals, 3 meals a day, and get away from the use of food in between, either as comfort or snacks. Then we ask them to get away from some bad carbohydrates because they do digest very easily into just plain old sugar. And that, of course, makes weight loss very difficult. So we have them focus on complex carbohydrates instead of simple carbohydrates like pasta and bread and potatoes. Certainly they can have it from time to time, but it's something we want them to start to kind of minimize. We then ask them to start to avoid liquid calories. Yes, we do put them on the shakes and the liquid diet immediately before surgery, a week or 2. But leading up to that period of time, we want them to actually avoid that kind of food. So shakes and smoothies and calorie containing liquids like fruit juices and sodas and soft drinks and high calorie foods that are liquefied are not a good idea. Those liquids tend to transit quickly through the stomach and leave a patient feeling kind of empty and hungry soon thereafter. Those foods don't require a lot of chewing, and so they don't tend to stimulate satiety as much as solid foods do. And so we want them to get away from liquid foods. We want them to get away from too much pureed and soft foods like yogurts and oatmeal and cottage cheese. And this is sometimes tough because these are foods that people tend to associate with good options for weight loss. But in the long term, they're really not, because they allow a patient to eat a lot more quantity. A patient can eat a lot more quantity of liquid and pureed foods. And so we tell them to do that. We tell them to be a little more mindful of their meals, not have meals in a fashion that's maybe distracted, or, while they're on the computer, or while they're driving, or while they're doing other things in the house. Mealtime is a time where you want to dedicate your attention towards eating and being mindful of eating. There are studies that show that when a patient is mindful of what they're eating, they tend to eat less. When they chew a little more, they tend to eat less. And so we want them to be more mindful of that and chew well and slow down their meals. And lastly, of course, we want them to become a little more active, and so exercise. And so it's not so much a diet that we put patients on, it's more of a lifestyle that we want them to start following, and that we'll hope then that they carry on after surgery.
What a great message. And with that, I think we've answered, a variety of questions that patients had. And I want to thank you both so much for your time tonight, Dr. Cussatti and Dr. Paine, and for our patients for joining us for this session. For more information about our bariatric services, patients can visit us at stopobesityforlife.com and learn about our providers like Dr. Cussatti. And for our plastic surgery offerings and services, and getting to our physicians like Dr. Paine, visit us at nybgplasticsurgery.com. Thank you so much, everyone. Thank you for your time, and have a great night.
Thank you, everybody. Good night.
Thank you. Bye-bye.